Veterinary Surgical Centers is the D.C. metro area's leading provider of small animal surgery, neurology, pain management, and rehabilitation services. Well, today, one of their doctors is joining us to discuss disc disease and how it can affect your pet. Well, Dr. Catherine Crook is here with us. First of all, what is disc disease? I've never heard of it.
Yes, so in our spine, and I have a model here, that the discs cushion between the vertebrae and the spine. And they absorb shock for animals and people anytime we do any sort of high impact type activities or just going through our day-to-day life. The discs can actually degenerate and over time put pressure on the spinal cord and cause problems for the pet secondary to that pressing on the spinal cord or that compression.
Okay, you hear a lot of these things happening in humans, but you don't think about the pets getting this. All right, so here you are, you've got a cat and a dog, or one or the other. Does it affect both?
It can affect both, but it is much more common in dogs. It occurs rarely in cats.
Okay. How do you know that your animal has it?
It's a good question, and one we get asked a lot. There are various signs that we can see. The first and probably most common is pain, and whether that's back pain or neck pain, depending on where the disc problem is. But that can also then progress to, in the most severe cases, complete paralysis and loss of any voluntary ability to move the legs.
Oh, that sounds so horrible.
Yeah.
You know, especially they can't really communicate, or at least not with words.
Yeah.
So if you suspect that your pet has this, what do? Of course, you call the vet.
Exactly. So if it's in the milder case, if you think your dog has neck or back pain, then starting with your primary care doctor, taking them in and getting them evaluated is the first step. And if they think they have a neurological problem, that's when they would refer to a specialist like myself to do more diagnostics and really get to the bottom of what's going on.
Is this the kind of thing that can be cured, or is it just managed?
It is. So we have a couple of options for management, and that can be medical management or surgical management. And the decision on which to proceed or pursue depends on how severe the problem is. In the case of back pain or neck pain, that's something that we can manage medically, and it has a good prognosis. And when I say medical management, I mean with medications or rest.
Okay.
If they fail medical management, or if they're much more severely affected, that's when I would recommend surgery, meaning if they can't move their legs or are very weak in their legs. And actually, in most cases, we have a very good prognosis for returning to walking again, or for regain of motor function with surgery.
Okay, I'm happy again. It's so sad. Just, you know, I've never heard of it before. And, you know, again, when anything happens with my little cat, I just freak out. That's my little baby.
It is. It's so severe and dramatic when it happens.
It is so severe and dramatic, and it's good to know that this isn't, you know, it doesn't mean that they have to deal with this like forever, that it can at least, if it can't be cured, at least it can be managed. Is this the kind of thing that you see often?
It is. It's one of the most common things that animals get referred to me as a specialist, as a neurologist. It's one of the most common problems that I see and that I treat and manage.
So I'm wondering, is there anything that maybe these dogs and cats are doing that maybe brings that on, or is it hereditary, or how do they even develop it?
Yeah, so it is. There are breeds that are predisposed, and so there is a component of a hereditary factor. But there's also things that they do in their day-to-day life, the stresses and strains, those high-impact activities that can contribute to the progression of the disease, or can contribute to them contracting the problem. You know, we talk about discs rupturing or bulging upwards and putting pressure on the spine. So if we, especially if you have a breed that's at risk, like a doggy, you know, shorter-legged dogs, doing things to minimize the high-impact activities, jumping off the couch, jumping out of the car, those things are going to
just take it easy.
Exactly. Those just low-impact activities are going to reduce their risk.
Good information. Glad there's a happy ending there. Thank you so much for joining us this morning.
All right. Thank you. Thank you for having me.
And we'll have more Let's Talk Live coming up right after this.